Welcome all. So another topic very important, very frequently asked in the examination is a maternal mortality. Okay. So when you get the question on maternal mortality, there may be full question also, there may be a short note also. Then we need to have the outline for this particular answer ready. So outline will be introduction, then certain definitions. That is the WHO definition of maternal death you are going to write, and other two definition, that is the late maternal death and pregnancy related death. Okay. So these are the three concepts which you should know. Then there are three indicators, maternal mortality indicators. One is a maternal mortality ratio, another is a maternal mortality rate, and third is a lifetime risk of maternal death. Okay, so these three indicators are important, out of which this ratio, maternal mortality ratio, is important. Then, if possible, and if you can remember the global burden and what is the burden in India, that you should mention. So these are the epidemiological aspects. Then classification of the maternal death, major causes of the maternal mortality, factors associated with the maternal mortality, and then most important is a three delays model. This is very frequently asked even in the vivas also. What are the three types of delays? Okay. Second is a strategies to reduce the maternal mortality and maternal death review. Okay, so maternal death reviews are conducted to reduce the maternal mortality. What is the role of that? And certain exam related point we are going to discuss. So the maternal death, how it is defined by WHO. So it is the death of the woman while pregnant or within 42 days or 6 weeks of termination of the pregnancy, irrespective of the duration and site of pregnancy, and the cause of which is either related to is death due to direct or indirect obstetric causes occurring between 42 days and 1 year. So up to 1 year, if there is a death due to direct or indirect causes, that is called as late maternal death. Okay. Then next is a pregnancy related death. So any death which is related to the pregnancy, here the accidental or incidental causes are excluded. But in pregnancy related death, death during pregnancy or within 42 days after termination of the pregnancy, irrespective of the cause. Okay, one is a maternal death, second is a late maternal death, and third is a pregnancy related death. Okay. Now, what are the indicators? As I mentioned, there are three types of indicators. One is a maternal mortality ratio, second is a maternal mortality rate, and third is a lifetime risk of maternal death. Okay, so first indicator is a maternal mortality ratio. That is the number of maternal deaths per 1 lakh live birth. Okay, so maternal deaths are actually measured per 1 lakh live birth. Here, the maternal death is the numerator, but the denominator is not a part of numerator. Okay, that is why it is called as ratio. The denominator is a live birth and the numerator is a maternal deaths. Okay, so it is not all the pregnancies, or it is calculated with respect to only live birth. Okay, if the total 100 women deliver, if there are 3 stillbirths, then those 3 will not be counted because those are not the live birth. If there are 100 pregnancy, there are 7 abortions, 3 stillbirth, so 10 are gone. Okay, if there is a one maternal death, so one maternal death out of 90 will be calculated if there are 90 live births. Okay, so this is what is the ratio, because here the numerator is not a part of denominator. Okay, second is a maternal mortality rate. So number of maternal deaths per 1 lakh women aged between 15 to 49 years, women aged between 15 to 49 years, that is the reproductive age group. Okay, so third is a lifetime risk of maternal death. So risk that a 15-year-old girl will eventually die from a maternal cause during her reproductive years. Okay, suppose a 15-year-old girl enters into the reproductive age group at so the girl will enter into the cause. That is called as lifetime risk of maternal death, and it has got two components. One will be related to the fertility, and another is how many times she is becoming pregnant and what is the burden. So these are the important factors for the lifetime risk of maternal death. Okay, so maternal death worldwide approximately around 2,60,000. Global MMR is around 197 per 1 lakh live births. This is WHO 2025 data. Okay, then deaths occurring mostly in the low middle income countries. Almost 95% of the maternal deaths are happening into the LMICs, low middle income countries, and out of which 90%, more than 90% are preventable maternal deaths. Okay, so certain global statistics you need to mention, especially if you have the full question. Okay, then woman dies approximately every 2 minutes from pregnancy related causes worldwide. Okay, if you see the data from the statistics from the India, currently the latest from SRS data from 2019 to 21, the death rate which was mentioned was a 93. Okay, it is further gone down. Okay, so that was from the SRS 21 data. Before that it was 103 between 2017 to 19. Before that it was 130. Okay, so India has already achieved national health policy target of less than 100. Okay, so two digit we have already achieved. Okay, then sustainable development goal SDG 3.1, the target for the 2030 was global MMR less than 70 per 1 lakh. That is the target which is to be achieved globally. Okay, then coming to the classification of the maternal death. Maternal deaths are classified as direct obstetric death, indirect obstetric death, or the incidental death. Okay, so direct obstetrical death are the where the cause is directly related to the maternity cause, like PPH, eclampsia, sepsis, ectopic pregnancy, abortion complications, etc. Then you have indirect cause like anemia, cardiac disease, diabetes, hepatitis, thyroid disorder, or CNS related cause. So these are all indirect causes, and incidental causes such as trauma, poisoning, accidents. So these are the incidental causes, and by definition maternal death will be either direct or indirect. These incidental causes are not included into the definition of maternal death. They will be included into the pregnancy related death. Okay, now let's see about the what are the major causes of maternal deaths and what are the key prevention. Okay, so when you are writing, if you write in this particular manner, that looks better. Okay, so hemorrhage, that is the main cause, around 20-25% contribution. And the important intervention, the treatment of anemia, active management of the third stage of labor, timely uterotonics, IV fluid, blood transfusion, surgical management wherever required. So these are the controlling factors for the deaths due to the hemorrhage. Okay, then coming to the sepsis, this contributes around 15 to 20% of the cases, and the prevention is possible by skilled birth attendants, aseptic delivery practices, early diagnosis, and broad spectrum antibiotics. So death due to the sepsis will be prevented from this. Then third is a hypertensive disorders, preeclampsia, eclampsia, etc. That contributes around 12 to 15%. Early detection, blood pressure monitoring, magnesium sulfate, antihypertensives, timely delivery. So these are the interventions which are possible for prevention of deaths due to the preeclampsia, eclampsia. Then another cause is the unsafe abortion, which is contributing around 10 to 13%. Access to the safe abortion services, family planning services, post-abortion care, antibiotics. So these interventions will reduce the deaths due to the unsafe abortions. For obstructed labor, around 8% contribution. So for this intervention will be use of partograph, early recognition and timely referral, and operative delivery facility. Okay, so then you can prevent the deaths due to the obstructed labor. Then anemia is the very important indirect cause. So most common indirect cause is anemia. Direct cause is a hemorrhage. Okay, so anemia contributes around 15 to 20% of the maternal deaths. So prophylaxis will be iron folic acid supplementation, nutrition, treatment of malaria, hookworm, blood transfusion wherever indicated, and other indirect causes contribute around 5 to 10%. And that is intervention will be management of cardiac disease, diabetes, viral hepatitis, thyroid disorders, HIV, tuberculosis, etc. So you need to manage these particular conditions. So from examination point of view, you should know the leading causes. So what is the leading direct cause? Worldwide is a hemorrhage, hypertensive disorders, and sepsis. The same causes are there in India also: hemorrhage, hypertensive disorders, and sepsis. Okay, so and apart from this, indirect cause will be the anemia. Okay, so the leading indirect cause is anemia, and direct causes are the hemorrhage, hypertensive disorders, and the sepsis. Okay, so what are the factors associated with maternal mortality? So they are classified as the maternal factors, socioeconomic factors, etc. So maternal factors, both age early age and the late age. Less than 20 years is associated with preeclampsia, CPD, obstructed labor. More than 35 years, there is a 3 to 5, 4 times higher maternal morbidity and mortality. Grand multiparity, more than 5 pregnancies, there is increased postpartum hemorrhage, malpresentation, uterine rupture, high chances. Primary gravida, slightly increased obstetric complications. Then socioeconomic factors are contributing to the maternal mortality, like poverty, malnutrition, illiteracy, poor housing, poor sanitation, limited access to the healthcare. Then health system factors such as inadequate antenatal care, lack of skilled birth attendants, delayed referral, inadequate blood bank facilities, poor emergency obstetric care, substandardized hospital care, etc. Then social factors like early marriage, teenage pregnancy, unsafe abortion, high fertility, gender inequality, and poor utilization of health services. These are the social factors. Another important question which is asked is about what are the delays which are related to the maternal mortality. There are three types of delay. Delay 1, delay 2, and delay 3. Delay 1 is related to the delay in deciding to seek the care. It is at patient level. Patient does not seek the health care. Okay, so delay in deciding the to seek the care. Second delay is a referral. It is at the level of the referral. So delay in reaching the health facility. Okay. Third delay is delay in receiving the appropriate treatment. So here comes the role of the medical professional or the hospital. Okay, so the patient has approached the health facility, but there was a delay in institution giving the treatment, or the wrong treatment is given, appropriate treatment is not received. So this is what is the delay 3. Okay, so what are the strategies to reduce the maternal mortality, or these are the components of safe motherhood. Okay, so whatever the factors we have seen already, we have to act on those factors. Like health sector actions will be quality antenatal care, skilled birth attendant at every delivery, institutional delivery, emergency obstetric care, that is basic emergency obstetric care and comprehensive emergency obstetric care. So BMOC and CMOC, these are important factors. Then what is BMOC and what is CMOC, that also we will see subsequently. Okay, there are 7 signal services which we are supposed to give under BMOC, and there are 2 additional services. One is a cesarean section and another is a blood bank facility. So if these 2 facilities along with 7 signal services, that makes a CMOC, that is the total 9 services. Okay, 7 BMOC plus 2 additional, that is a cesarean section and blood bank facility. Okay, blood transfusion services, functional referral system, prevention of unsafe abortions, then family planning services, maternal death review and confidential inquiry, regular training of healthcare providers. So these are the factors or the actions which should be taken at health sector level. Okay, at broad level. Then at community level, what actions should be there? There should be health education, women's empowerment, birth preparedness, early recognition of danger signs, management of medical disorders, community participation, and safe motherhood committee should be there. Then health planner and policy actions. Strengthening of the referral services, standard treatment protocol should be there, periodic training, quality assurance, maternal death surveillance should be there, and periodic audit should be there. Then legislative and policy action should also be there to reduce the maternal mortality. There should be delay age at marriage. Okay, so this age at marriage should be improved or increased. Improve girl child education, improve nutrition, universal access to maternal health care, safe abortion services, gender equality, and universal health coverage. So these are the legislative factors. Okay, so what is the role of maternal death review? Every death needs review. Okay, because every death we come to know the where the things have gone. It may be at medical facility level, it may be at other factors, because social factors are also contributing. So every maternal death needs review. What are the objectives of maternal death review? One, identification of the medical cause. Second, identify avoidable factor. Again, I am telling you, every medical death may not have medical cause. It may have got some social cause also. Okay, so we need to identify the avoidable factors, improve the quality of care, and prevent future maternal death. Okay, then what are the types of maternal death review? One is a facility-based review. That is the hospital facility where the maternal death has happened. There should be the discussion of that particular case. Okay. Then second is a community-based MDR. That will include all the chain of events which are involved in treating that particular patient. And third is a confidential inquiry into the maternal deaths. So these are the three different types. Okay. So from examination point of view, certain points which you should remember: common direct cause worldwide is a postpartum hemorrhage. Then common indirect cause in India is anemia. Gold standard indicator for maternal death is a maternal mortality ratio. Then current maternal India MMR is 93 per 1 lakh live births, but this is 2021, not the 25-26. Okay. SDG target is a maternal mortality rate by less than 70 by 2030. Okay. So maternal death is a death during pregnancy or within 42 days due to pregnancy related causes. MMR, maternal death per 1 lakh live births. India 1920, 21, 93 per 1 lakh live birth. Then global MMR 197 per 1 lakh live births. 2,60,000 maternal deaths occurred worldwide in 2023. Hemorrhage remains the leading direct cause of maternal mortality worldwide, and anemia is the leading indirect cause in India. There are three delay model. That is a favorite viva question. And skilled birth attendance, emergency obstetric care, timely referral, and blood transfusion are the most effective interventions for reducing the maternal mortality. Okay, so that finishes this particular topic. Thank you.